As part of the redevelopment of Whakatane Hospital, a history wall has been constructed to celebrate over 100 years of growth and development at the Whakatane Hospital campus. To celebrate the unveiling of the history wall, an unveiling ceremony has been organised for the 7th of August 2013. Guests are welcome to the hospital site by Puro to Ngā Ropo and Regional Māori Health Services.
All those our distinguished dead, in particular those who have been part of the
Aura Te Reo of Ngāti Porou was then welcomed by board and committee representatives. Chairperson of the District Health Board, Sally Webb, thanks Dr. Ian Shearer, author of the Whakatane Hospital History, and the committee of volunteers that developed the boards, with the assistance of Sally Llewellyn, multimedia designer. Yvonne Boyce, chairperson of the History Wall Committee, calls all those significant contributors to Whakatane Hospital to unveil the panels as they are blessed. Each panel is to be unveiled by people who have had some connection to the decade they are unveiling. Everyone arrives in the corridor before the unveiling and blessing of the panels. Jeff Hodson, General Manager Property Services, unveils a plaque commemorating the Whakatane Hospital logo. The first panel, 1900 to 1919, is unveiled by Ian Lawrence of Ohope, grandson of Alexander Peebles, who was the chairman of the hospital board from 1911 until 1934, and a representative of the family of Akanehe of Te Kaha, who was the first Māori registered nurse and midwife. The 1920 to 1929 panel is unveiled by Neville Prideaux of Paengaroa, first cousin once removed of Frank Prideaux, who was the hospital's secretary-treasurer from 1921 until 1939, and again from 1945 until 1951, assisted by a representative of the local RSA. The 1930 to 1939 panel is unveiled by Bob Wadmore of Putararu. A distant cousin, Dr. Wadmore, medical superintendent at the Mission Hospital from 1920 until 1923. Also assisting with the unveiling is Judy Baker, representing St John's Ambulance. The service commenced in 1939 in Whakatane. The 1940 to 1949 panel is unveiled by former Mayor of Whakatane, Don Herdman, and former nurse and board member Puti O'Brien. Don's wife had been a nurse who graduated from Whakatane Hospital in 1949. Puti is featured on the history wall with a photo of graduation in 1945. She worked as a public health nurse in the Eastern Bay of Plenty from 1951 to 1982. The 1950 to 1959 panel is unveiled by Elspeth Lunn, Marion Wilson, and our longest-serving staff member, Rona Stanley. Rona was a very instrumental part of the History Committee. Elspeth was a nurse here for 30 years and gave enormous support to student nurses. Marion was the first and only teacher employed on the paediatrics ward until 1980. The 1960 to 1969 panel is unveiled by Jim Savage and Shirley Matchett. Jim, who is from the Whakatane district, represented New Zealand in the Paralympic Games in Israel and won a bronze medal. Shirley was a kitchen supervisor from 1957 to 1991. The 1970 to 1979 panel is unveiled by Nancy Nelson, a former senior nurse at the hospital and recently retired consultant paediatrician Dr. Chris Moyes. The 1980 to 1989 panel is unveiled by Maggie Dominic and Margaret Lambert. Maggie's husband was an anaesthesiast here for many years, and Margaret was chair of the Opotiki Hospital Board. The 1990 to 1999 panel is unveiled by Liz Hanson and Matthew Preston. Liz graduated from Whakatane in 1960 and is still nursing here. Matthew, a radiologist, is also still at the hospital and held the position of medical leader in 1996. And the last panel to be unveiled is the year 2000 to 2009 by Mary Hackett, Board Chair from 2001 to 2010, and Karen Smith, General Manager of Whakatane Hospital from 1999 to 2004. Guests gathered in the chapel where the chaplain acknowledged how the series of panels showed the growth and development of the Whakatane Hospital campus over a period of 100 years, before blessing and closing the ceremony.
We now travel to the new. Keep us travelling along with you. And so with that...
Guests then attended a celebratory lunch at Regional Māori Health. Through the volunteered time, commitment, enthusiasm and energy of a small group of people, the organisation now has a treasure of the past for future generations to enjoy.